Dear students, welcome back. In the previous session, we have discussed about hip complex. Now, in this session, we are going to discuss about the knee complex introduction as well as what are the structures which forms the knee complex, and we are going to discuss about one of the structure of the knee complex. Okay, the knee complex is almost similar to the elbow complex, and in that of flexion and extension of the knee produces a functional shortening and lengthening of the extremity. In addition to providing mobility, however, the knee complex plays a major role in supporting the body during dynamic as well as static activities. In the case of closed kinematic chain, the knee joint works in conjunction with the hip as well as the ankle. So, for example, this one is the lower limb. So, in the closed kinematic chain, it is going to work in conjunction with the hip joint as well as the ankle joint to support the body weight. Okay, to support the body weight in static erect posture. Okay, yes, this is the closed kinematic chain. Okay, dynamically the knee complex responsible for moving and supporting the body in sitting and squatting activities, and for supporting and transferring the body weight during locomotor activities. So during sitting and squatting also, again it comes under closed kinematic chain only. In the erect stance, okay, the first one we have discussed is the erect stance. It is going to work, the knee joint is going to work with hip and the ankle, whereas in sitting and squatting also the ankle and the foot is on the ground itself. So again it becomes the closed kinematic chain. But also some movements like sitting and squatting activities, so in that position also knee is giving support and also the transferring the body weight during locomotor activities. Now we'll see in an open kinematic chain, the knee provides mobility for foot in space. So during walking, isn't it? So the knee will move the leg and foot, and by the bending of or flexing the knee, it takes the leg away from the foot, and also it helps in gait. Okay, simply we can say the knee provides mobility for the foot in space. Okay, so the fact that the knee must fulfill major stability as well as major mobility roles is reflected in its structure and function. So in closed kinematic chain as well as in open kinematic chain, in both the cases the knee plays a key role in supporting the body as well as, and it helps in mobility also. So based upon these major roles, the joint structure has been designed. Okay, so the knee is not only one of the largest joints in the body, but it is the most complex joint. Nowadays the engineers have developed the prostheses which are capable of simulating some of the functions of the knee joint. Okay, now the knee complex is composed of two distinct articulations within a single joint capsule. As we know that this one is a synovial joint, that is diarthrodial joint. Okay, and also this one is a modified hinge joint. This one is modified hinge joint. Okay. Now, so inside each diarthrodial joint is having a joint capsule. Inside the joint capsule, it is having two distinct articulations. Look, one is so as we know that the knee complex is formed by the articulations of three bones. One is the femur, tibia and the patella. Okay. So inside the capsule, the joints are, one is the tibia, this one tibia and femur. So these two bones are getting articulating, that is called as tibio-femoral joint. And here the patella is articulating only with femur to form patellofemoral joint. These are the two joints articulating inside the capsule forms the knee complex. Knee complex constitutes two joints. One is tibio-femoral joint and patellofemoral joint. Okay, if you take only knee joint, it only articulates with tibia and femur. Knee complex means it constitutes tibio-femoral as well as patellofemoral joints. Okay. Yes. This patella serves the tibiofemoral mechanism. The characteristic responses and problems of the patellofemoral joint are distinct enough from the tibiofemoral joint to warrant separate attention. That means although these two joints which are present inside a single capsule, but the problems of patellofemoral joint are distinct from tibiofemoral joint. So you have to keep it in mind and you have to separate the problems, whether the problems are actually coming from tibiofemoral or patellofemoral joint. Okay. So that one you have to understand in this chapter. So what is the structure of tibiofemoral joint and patellofemoral joint, and in the tibiofemoral joint what is the structure and what is the function. The same way in the patellofemoral joint also we are going to discuss about the structure as well as function separately. Okay, and then the superior tibiofibular joint is not considered to be a part of the knee complex since it is not contained within the knee joint capsule. Okay, and it is functionally related to the ankle joint. Okay, now this is about the introduction to the knee complex. Now we will move on to the structure of the tibiofemoral joint. So the tibiofemoral joint or knee joint is considered to be a double condyloid joint, okay, with 2-degree freedom of motion. Flexion extension occurs in sagittal plane around a coronal axis, while medial and lateral rotations occur in transverse plane about a vertical axis. So the careful examination of the articular surfaces and the relationship of the surfaces to each other will facilitate a good understanding of the movements at the knee joint and both the functions and dysfunctions which are common to this joint. Now first we are going to discuss about the proximal articular surface or femoral articular surface. Okay, yes. Now this is the proximal articular surface of the knee joint is formed by the distal end of the femur. That femur consists of two condyles, medial and lateral condyles. This one is medial and lateral condyles. which is located on the distal femur, form the proximal articular surfaces of the knee joint. Okay, the condyles have a large and very obvious curvature antero-posteriorly, but it is also having each slightly convex in the frontal plane. So each condyles appears to be convex slightly in the frontal plane. If you see in the AP, it is having more curvature at antero-posteriorly. Okay. Now this AP convexity of the condyles is not a consistent spherical shape. Okay, this convexity is not specially a spherical shape, but has a smaller radius of curvature posteriorly. Okay, the two condyles are separated by a notch called as intercondylar notch. So this is the posterior aspect of the femur. So here you can find an intercondylar notch or fossa through most of their length. So this fossa is present through most of their length, which is separating the two condyles, but are joined anteriorly. So this fossa is joined anteriorly, but posteriorly it is separating the two condyles most of its length. Okay, and on the anterior aspect of the femur, that is the distal femur, it is having an asymmetric shallow saddle shaped groove called patellar groove or surface. We can see that is called as the patellar surface, which is separated from the tibial articular surface by two slight grooves that run obliquely across the condyles. Normally this one is present at this area. The shaft of the femur is not vertical, but it is angled in such a way that the femoral condyles do not lie immediately below the femoral head. So as we know that the femur is making an angle with that of shaft, isn't it? And the shaft is on the medial side, it becomes some obliquity, it shows some obliquity, and the lateral aspect may follow somewhat straight with that of the lateral condyle, and towards the medial condyle it forms some medial obliquity on the medial aspect here. Okay. So given this obliquity of the shaft of the femur, the lateral condyle is more directly in line with the shaft of the femur than when compared to the medial condyle. So the articular surface of the lateral condyle is not as long as articular surface of the medial femoral condyle. Okay, so when the femur is examined through an inferior view, the lateral condyle would appear at first glance to be longer. However, when the patellofemoral surface is excluded, it can be seen that the lateral tibial surface stops before the medial. The medial femoral condyle is on average 2/3 of an inch longer than the lateral condyle. Okay, so that when we can see here, yes, so this one. So here we can see the medial femoral condyle is greater than the lateral femoral condyle, and also we can find here the lateral patellar surface and medial patellar surface also. Okay, the medial condyle extends further distally than the lateral, so that in spite of the angulation of the shaft of the femur, the distal end of the femur is essentially horizontal. Okay, to make the femoral condyles horizontal. So this medial condyle extends further distally than the lateral. Because of that angulation of the shaft of the femur, the distal end of the femur is essentially horizontal. This becomes horizontal. Okay, so this is about the proximal articular surface. Okay, how the condyles are, and how the condyles are separated, which condyle is bigger than which, and why it is bigger, and why the lateral condyle appears to be larger, and after removal of this patella we can find the medial condyle is larger than the lateral. Okay, so these are the things we have seen. So these two condyles, lateral and medial condyles, are going to articulate with the condyles of the tibia. Okay, so now we will move on to the condyles of the tibia, or the superior view, and we are going to discuss about the tibia here now. Yes, the articulating surfaces on the tibia that correspond to the femoral articulating surfaces are the two concave asymmetric medial and lateral tibial condyles. So it is having an asymmetric medial and lateral concave condyles. Okay, these condyles are also called as plateaus. Okay, the proximal tibia is enlarged as compared to the shaft. So when you see the shaft, the proximal part of the tibia is enlarged. Okay, and compared to the shaft, and it overhangs the shaft posteriorly. Okay, the articulating surface of the medial tibial condyle is 50% larger than that of the lateral condyle, and the articular cartilage of the medial tibial condyle, the articular cartilage of the medial tibial condyle is 3 times thicker. Okay, the articular cartilage of the medial condyle is 3 times thicker. The two tibial condyles are separated by an roughened area and two bony spines, here. So the two bony spines called as intercondylar tubercles. These tubercles become lodged in the intercondylar notch of the femur during knee extension. Okay, now we will see in this X-ray. So in the top you can see the intercondylar ridges or eminence which are going to fit into the intercondylar notch of the femur during extension. Okay, if you see the tibiofemoral articulation, when the large articular condyles of the femur are placed on the shallow concavities of the tibial condyle, the incongruence of the knee joint is quite evident, because the femoral condyles are large when compared to the tibial condyles. That means it is having some incongruence. So this articular incongruence at the knee is accompanied by an accessory joint structure which enhances the congruence and assists in the balance between mobility and stability needed by the joint. Each condyles of the knee joint has its own accessory joint structure, together known as menisci. So it is having menisci. With this menisci, the articular incongruence is going to be decreased, and which enhances the congruence and helps in the balance between the mobility and stability which is needed by the joint. Okay, so this is all about the articular surfaces, and this accessory articular surfaces that is called menisci, which is present in between these two joints to increase the articular congruence. Okay, and helps in mobility and stability. These are all about the articular surfaces of the knee joint or tibio-femoral joint. Okay, now we will move on to tibio-femoral alignment. Okay, tibio-femoral alignment and weight bearing forces and the menisci in detail in the next session. Thank you.